Good evening, ladies and gentlemen. On behalf of Ceylon College of Physicians, I'm Himantha Korala. Welcome to the fourth episode of the innovative series of webinars titled Collegia Unitum Scientia, Colleges United in Science. Today, I am honored to feature Dr. Pandula Siribardana, Senior Lecturer in Medical Education at Postgraduate Institute of Medicine, to tell you all about this webinar series. And to further introduce our guest speaker, I cordially invite the President of Ceylon College of Physicians, Professor Arosha Disanayak. Over to you, sir.
Thank you very much, Himantha. A very warm welcome to Dr. Pandula Siribardana, a long-standing friend of mine. We've worked a lot together in the PGIM. And then a very warm welcome to all of you in the audience. I'm glad that you took time off to join this process. When we started this Collegia Unitum Scientia series, in Latin, that's Latin, and what it roughly means is Colleges United in Science. Now, traditionally, the CCP has many sister colleges, many subspecialty colleges within it, and we've been collaborating with those for a long time. But this year, we started a new initiative, the Collegia Unitum Scientia, where we are reaching out to the non-traditional partners of the CCP, the non-physician colleges. So we've had talks from College of Surgeons, College of Psychiatrists, etc. And for this month, we've chosen a very novel topic. We're going to talk about digital health, and we have one of the foremost experts on digital health, the use of digital health in Sri Lanka, Dr. Pandula Siribardana, who has very kindly agreed to be the speaker today. Digital health, we've been forced to adopt digital health in a large way due to the current price problems that we've faced. And what I want to tell you is that use of digital health extends, I think, a lot beyond the use of Zoom lectures and perhaps telemedicine consultations. It's a lot more than that. In the human race, there has been the agricultural revolution, the industrial revolution, and at the beginning of the century, the IT revolution. And at the moment, I think we are going through an IT revolution within medicine. And all I need to tell you all is, if we miss the IT revolution within medicine, we are doomed and we'll lose our way. So we need to be, all of us need to be partners in the IT revolution in medicine. And we are fortunate to be living in these times where we are actually seeing the revolution happening right before our eyes. Now, industrial revolution, we've heard about it. We've read about it. We've seen the steam engines and wondered and marveled at those creations. But we are living in the time of where the IT revolution in medicine is actually taking place. So we are live witnesses to this process, and we need to move beyond being witnesses to being live partners. So that's why the CCP Council, after a long discussion, thought that this would be a very important lecture. This will be uploaded to the CCP YouTube channel in 1 or 2 days. So if there are any, if you all can think of anybody else who might you think will benefit from this, please ask them to join the CCP YouTube channel and have a listen of this either today or tomorrow or so. So that's in terms of introduction for today's program. And to introduce our eminent speaker and to conduct the program, it is my great pleasure and privilege to request Dr. Himantha Korala. He's a council member of the CCP, and he is the lead for this Colleges United in Science, or the Collegia Unitum Scientia program. That the Latin name was also coined by him. So it's my great pleasure and privilege to hand the proceedings over to Himantha. Thank you once more, Pandula. It's a privilege to have you on board on behalf of the CCP. I hope all of you have a very productive evening. Thank you. Over to you, Himanta.
Thank you, sir. Now, Dr. Siribhadan is a senior lecturer in medical education at Postgraduate Institute of Medicine at the University of Colombo with a passion for digital health. He's an honorary fellow of the Commonwealth Center for Digital Health and leads the Commonwealth Digital Health Awards since 2016. He has also contributed to many local and international digital health projects, including as an inventor, securing a US patent. Pandula will deliver a speech titled From Consumer Tech to Digital Therapeutics, the Changing Landscape of Digital Health. Over to you, Pandula.
Thank you very much, Himanta. I will share my screens now. Right. I hope it can, the slide can be seen. Yeah. Himanta, am I visible?
Yes,
Right.
it's
Yeah.
right.
Well, first of all, thank you very much, CCP, the college, the organizers, Himanta. Thank you for part of this series of webinars, because it's a great idea to bring the colleges together and share the knowledge, experiences, everyone benefit. So today's session, the topic that we decided, as Himanta said, the consumer tech to digital therapeutics. This is based on some of my own experiences being the convener for the Commonwealth Digital Health Awards since 2016, where we have from scratch been able to establish one of the foremost digital health awards events in the world, where we attract more than 300 applicants from around the globe on digital health and related technologies each year. And this has given us a lot of insights, myself, the team, the Health Informatics Society of Sri Lanka, the Commonwealth, about the emerging trends and where the investments are going. And given the today's situation, we all know that technologies evolve where the investments also go. And basically some of these that are and impact how we practice as well. Of Sri Lankan flavor to this discussion by highlighting some of the innovations taking place here, because that's also important for us to know that these digital tech innovations don't necessarily take place only in the West, but sometimes most of its innovations take place in the South, and Sri Lanka is no different. And we have a lot of experts, innovators, who have done a lot of new inventions related to digital health. But unfortunately, the investments doesn't go into these projects, and that probably curtails their progression. I thought I will start by highlighting some of the big names in not in health, digital world. All of these companies, and you may have already interacted with their services and taken their services. Even at this present moment, you may be using these services. Now, what all these companies have in common is that they are technology based, and the core business may be different, yet embedded in technology. Not only that they use technology to deliver their services, but they also make use of technology as an intelligence tool. And this intelligence that they gather ultimately contributes to not only providing a better service to the consumers like us, but also in terms of increasing their profits. And that's how today's technology firms evolve. And so this trend can be seen even in health as well. For example, what you're seeing now is a study done, is a survey based mapping done by the CDC in US, some of the US counties, with regard to acute heart disease related mortality. This was done based on the traditional modes of hospital-based data. What you see now is a survey, basically a data analytics, done not using hospital-based data, but using Twitter posts. The Twitter posts that they have analyzed basically discusses about stress levels, negative thoughts, negative feelings, or whatever that basically increases their stress. All this information, more than 826 million tweets have been mapped, have been mined, analyzed, processed. And what they recognized ultimately was a pattern similar to what we have traditionally would have achieved using hospital-based data. Now, this basically tells us that in the future, the health-related predictions, mappings, decision-making may not necessarily be coming from the data emerging from the health sector. The data may be emerging somewhere else, in social media, Twitter, Facebook, or any other. And the data that we are harnessing in the future may not necessarily be structured data as we see in the modern context. So the power of technology is such, the big data analysis, the technology and its power is such that you can identify patterns that you previously wouldn't have even guessed. The health sector is now only moving into this, whereas the previous businesses that I've just mentioned have already started using it, and they have intelligence in order to identify a consumer's behavior by the time that the person logs into their platform. So this is the enormity and the power of modern day digital health, and let us now discuss further about its nuances. Now, as you all know and heard, there are so many digital technology companies nowadays working in health. This is just a cross-section of most influential startups related to digital health in 2021. This changes every day. These change. Not all the startups last also. They fail. Some will thrive. But in the new year, in 2022, this landscape would have changed. But if you can see the key areas where these startups are working, it can be in many different areas. It can be in imaging, it can be in virtual care, digital therapeutics, data analytics, clinical intelligence. All sorts of areas have opened up in digital health where different companies, different startups are putting their innovations to work. And this is what forms the digital landscape even at present. Now, consumer health tech, which is our first part of my presentation, can be described as any form of technology that is intended to be used by the consumer, that is the general public, for health and well-being purposes. So this means that the technology that is falling into the category of consumer health tech can be used by an untrained person, a lay person. So there's no need of a professional to intervene. So those are the consumer health tech products. Why consumer health tech is important? Most of the investments nowadays tend to go into the consumer health tech sector because of the lack of regulatory requirements as well as the demand from the side of the consumers. And as a result, a lot of investors are keen on investing in consumer health tech because for investors, these may be quick gains. But at the same time, the people are becoming more aware about what they really need, what they really want to do, and they want to make decisions by themselves. And for that, they demand tools, as with any other sector, travel sector also, the consumers are demanding with regard to what they want, and digital health is no different. Now, some of the most, I will just highlight some of the technologies that we consider as consumer health, and a little bit about what they can do for us. Wearables is something that we often come across. You may be wearing now that may be monitoring your vitals, maybe monitor heart rate, temperature, a step counting, maybe listening to certain sounds that are made for in our body. Even our clothing may be considered wearables to a certain extent, that will monitor certain parameters and provide us with a feedback. These are the wearables that we come across. Our watches, our mobile phones, all of these technologies may be considered wearables depending on how it is used for health. Largely, these kind of technologies do not make any diagnostic claims. They basically will monitor certain parameters and give us a feedback, indicating, advising us in terms of better health practices. That's about it. And it may not really be used for anything significant in terms of diagnostics or management of a patient. That's why they are called consumer technologies. Now, there may be different types of technologies used within these wearable devices or even outside there. For example, artificial intelligence, as you all know, is something that is built into most of the tools that we are coming across, and it's being used so much that we consider artificial intelligence to be built into any sort of software that we may come across, but it may not necessarily be the case. What you're seeing here is one of the projects that being done with regard to skin lesion classification. Basically, if you have a mobile phone, you take an image of the lesion on your skin, and a software will be able to identify whether this lesion is a benign lesion or a cancerous lesion. And based on that, it will be able to give a feedback as to whether one should go and meet with a doctor or whether further investigations may be done. So these are the kind of softwares that are AI-based or artificial intelligence-based. In this instance, it basically looks at an image and processes it based on the data sets that they already have. This is one of the projects that we have been involved, myself and a team, for which we were able to secure a US patent also. What it basically does is, it allows a person to take a photograph of your front teeth using the mobile phone, and the AI will detect early erosions that may be appearing on your teeth. Now, why early erosions? Because it's something that, if detected early, can guide the person to take various precautions in order to prevent it from developing or becoming more serious. And therefore, this kind of guidance can basically provide the consumers with, can empower the consumers so that they can, the parents actually can also look after their children's teeth as well as their own. So these are types of AI-based technologies that are now very abundant for various purposes. Oral health, it may be skin health, and various other even cosmetics related health related conditions. Anything may be tackled through these kind of AI based image processing techniques. This is again another project that a team of Sri Lankan scientists and health informaticians were involved. Here, what we basically was looking for the changes in patterns of breathing. And these, what you see, are spectrometric patterns of cough, breathing, and respiration, cough and respiration. Now, you can see that there are unique patterns, and if analyzed and if a proper data set is being produced, you can actually see changes that may be taking place in this voice prints or sound prints. So this kind of becomes a biomarker for respiratory health. And there's a lot of studies being done at the moment. We are also involved with studies with a foreign university as well, because this is becoming one of the more highly demanding areas with regard to remote monitoring of patients. And this particular tool that we have developed, we have also used as a test case in one of the ICUs in the country to assess whether it can basically give us a heads up with regard to any breathing performance deterioration. This is one of the examples where a breathing performance deterioration was noted in the app that the patient was using before a decision to admit the patient to the ICU was made. Although this does not really prove that the breathing performance is accurate enough, it needs a lot of research and evidence gathering. But this does indicate there's a potential for these kind of technologies to be used for early warning, particularly home monitoring. And this was developed for COVID-based home monitoring. And this kind of a tool in the future may be developed for monitoring patients with long-term respiratory conditions at home as well, and communicate with the physicians. Now, this is again another technology that came through the Commonwealth Digital Health Awards, a mind drone, and basically it measures the EEG patterns of your brain. And with that changing patterns, it's possible for a person to control a drone. And the benefit of this kind of a technology is that you can use the technology to train people. For example, people with attention deficit disorders, or who wants to develop their concentration further, they could be trained using these kind of technologies and games, because it measures your brain signals, which are and may be rewarded for brain signals that are desirable, or that will help the person concentrate more or achieve a particular milestone. So these kind of technologies can also be developed and are also kind of is in the market as well. But these technologies are developed by a group of engineers from Moratuwa. Again, another one. This is basically uses a technology called natural language processing, where for people with certain disorders, it's very difficult for them to comprehend what a person in the normal speed of talking delivers. So basically, they will have to get the assistance of someone else to interpret what the person may be saying. But this particular tool processes someone's speech and breaks it down into a simple way where the other person with the disorder can comprehend what that person will be saying. And this may be fitting the need of the person. It may be based on images, it may be based on simple terminologies. So the technology is based on natural language, technology called natural language processing, where the algorithms are able to identify natural speech, that what we talk, convert into more meaningful speech for people with disabilities. Then another area that we may come across in a big way in the future is augmented and virtual reality. I'm sure many of you have already experienced the thing called Metaverse, recently Facebook changed its name to Meta, and the reason for that is that they made huge investments for the new. They are making huge investments in terms of converting the social media platform into a virtual world, and that's going to be the future. And similarly, there's a lot of investments going into using augmented and virtual reality for health purposes. For example, two news articles that I extracted here. One is using it for pain management, non-opioid based pain management. And in the other one, it's basically using with regard to physical therapies. Similarly, it may be used for mental health disorders, cognitive behavioral therapy, even for training of healthcare professionals and so on. So augmented and virtual reality is going to be one of the key areas in the future, because there's a lot of investments going on, and there's the new generation will obviously become part of this particular technology from the very small age, which means that as they grow up, they will demand the services that we deliver through health or in any other field for that matter to be also part of the virtual reality that they are now part of. So this is an area that we may see more of in the future. So this is a little bit about metaverse, how it may appear. It appears in it's more artificial and appear a bit cartoonish for you, I suppose. But once you are engaged with it using these headsets, you become part of it. You become your own avatar, and basically some people tend to like being an avatar in a virtual world than interacting with their own environment. But leaving that aside, virtual worlds allow creation of places and provision of services that you otherwise wouldn't be able to imagine. But the whole idea is to give the user the perception that they are basically receiving the same care otherwise that they would have received in a hospital setting or in any other setting with the same degree of professionalism. Right. So this is about consumer tech and a glimpse of what sort of technologies may come across your way as a healthcare professional, and how your patients may deal with these technologies and the services that they may obtain. Of course, this is just a few of these technologies. There may be a lot more. What we need to expect, however, is that the patients or the general public will become more aware, will demand these technologies, and they become their own decision makers, which is what we also want them to do to a certain extent with person-centered care and empowering patients. These concepts are geared towards those. The technology does facilitate that. Now, before moving on to therapeutic, our next part of the session, which is about digital therapeutics, I would like to talk a little bit about this therapeutic relationship. I'm sure you all are quite familiar with this. Therapeutic relationship is based on concepts of professional intimacy, power, empathy, respect, trust. This what makes a relationship between a healthcare professional and a patient or a client stronger and meaningful. And that collaboration is what basically provides a better outcome to the patient. Now, with the digital part coming in, traditional therapeutic relationship is going to change. And how it changes in digital therapeutics is that the person in the form of the healthcare professionals will no longer be part of that particular relationship, at least in the initial encounters. That is how digital therapeutics may change the therapeutic relationship. This is not to say that the healthcare providers or healthcare professionals will no longer play a part, but at some point in this therapeutic pathway, the software will take over the role of the healthcare professionals. So this may sound alarming, but it's not really the case, because it's a step of the transformation of digitization of healthcare systems. We'll move on a little bit further. So what digital therapeutics is all about is delivering medical interventions directly to the patient. However, these digital therapies, in order for it to be delivered to the patients, needs to be evidence-based and clinically evaluated. And that's where the consumer technologies and the digital therapeutics will differ. Now, the consumer technologies that I talked to you about may not really be making any claims of diagnosis or management. It may just facilitate the health and well-being of the person. For example, a step counter may not do any diagnostic claims, but it will facilitate the health and well-being of the person. However, the digital therapeutic softwares will do much more than that. It may take the decisions on behalf of you. It may tell you to take a particular medicine at a particular dose if you have missed it. So this is the kind of difference between the digital therapeutics that I'm talking about and consumer technologies that I talked about previously. The two key things for this is evidence-based and clinically evaluated softwares. Now, a little bit of comparison between the more commonly identified digital tools, for example, wellness apps, pill reminders, dosing schedulers, CBT tools, insulin pumps, and so on. All these are digital tools. However, for these tools to be digital therapeutics, they need to be software driven, they need to be evidence based, and it needs to make a claim. And if it fulfills those criteria, then they may be considered digital therapeutics. But if they are not making those criteria, for example, many of the technologies are software driven, but they are not evidence based. They have not been taken through clinical trials, or they don't make any claims, largely because they don't want to fall into the regulatory category of a medical device. So if that is the case, we don't consider them as digital therapeutics. Now, in a traditional drug development process, we know that it goes through these phases: phase 1 clinical trials, phase 2 trials, 3 trials, approvals, and then there are certain phases. It takes about 10 to 15 years for these to go through, apart from the vaccines that we saw for COVID. Otherwise, it takes that much of time and effort and money. Similarly, a digital therapeutic product to come into the market, it has to also go through a preclinical phase, prototype-based trials, and then, of course, development and certification phase. Now, while Sri Lanka may not have the regulatory processes to deal with this, in US and other countries, developed countries, they have established ways of getting approvals. Probably still haven't matured to the way that we want it to ultimately manifest. But to a large extent, for example, FDA has a process where digital tools will be evaluated as digital therapeutic products. Now, why that is important is, once a product is validated and approved as a digital therapeutic, the doctors can prescribe that technology as part of the treatment protocol. So basically, if I'm a practicing consultant, I may prescribe a particular app to be used by my patients as part of my care. And it is important in those settings, because otherwise the insurers will not cover the cost of those technologies. But with the digital therapeutics, that no longer is the case. And sometimes the insurance coverage may give incentives for using these technologies for patients who may require such monitoring or care. And this is how the digital health ecosystem evolved. It's not only about the technology and the disease, it's also about insurance, investment, costing, the market trends, everything plays a significant role in how a technology becomes a digital therapeutic, similar to any drug development, vaccine development, and finally getting it into the market. These are few examples. For example, certain tools are there for diabetic care. There are certain tools for alcohol misuse and treatment. There are tools for respiratory health, Propeller and Carmo, which is basically a spirometry type of tool that can make decisions for you. So these are regarded as digital therapeutics because it allows the consumers themselves to make decisions, and it does claim either a diagnosis or a prevention or any other step related to managing of a particular condition. Right. So what can digital therapeutics give a particular client? And as you may now realize, patients will have quick access to clinically validated, safe digital care treatment. It will be personalized. Generally, these softwares are intelligent enough to deliver a care fitting the needs of the patient. For example, the Propeller app and that particular tool basically measures the way someone takes the inhaler, and it has the capacity to decide whether the inhaler technique is correct, whether enough medicines have been delivered, or how many times the patient has used it, and compare with whatever the data that is available previously, match it across the pattern that fits the person, and then make suggestions with regard to taking any additional medications, an additional inhaler, or seeking professional help. The data may also be shared with the clinician, which means that the clinician will know the next time when the patient comes, or even before the patient comes, the clinician will know, okay, this patient has been adhering to the practices, but yet the condition is not improving, or even though the medicines have been prescribed, this patient's technique is not good enough in order to get the full benefit of the treatment, and therefore proper arrangements can be made in order to facilitate better care. And also, this also takes off the costs of hospital-based care, because these are largely at-home therapy, convenient, and also it allows clinicians more reach, because at the moment we don't have a way of looking after our patients or monitoring our patients, even if we wanted, at home. And therefore, sometimes clinicians may be taking the decision to keep patients at hospital for a longer period of time, or taking measures so you prevent complications by administering additional drugs or different strategies of care, and so on and so forth. But those may not necessarily be aligned with the guidelines or the protocols or the evidence base, but you are basically making decisions on the hunch that the patient may not really comply. But this way, you have access to the patient and you can monitor the patients even at home. And that's the type of benefit that digital therapeutics can bring in. These do have problems. For example, these two companies, Theranos and Ubiome, have made claims that were not founded, but there's a lot of investment going in. A lot of patients have depended on these systems for a while in the US. Even the regulators were supporting it to be implemented. Millions or billions of dollars were poured in, but ultimately proved to be false claims. Basically, for Theranos, it was use of a fingertip blood for doing lots of diagnostics, including cancer detection, which were then proved wrong and have led to making false decisions or erroneous decisions with regard to certain cancer patients as well. So both these companies are out of business now. They had to close down. But the damage that they did because of these claims, which were not validated and which were not regulated adequately, was enormous. And therefore, the digital health technologies that are coming up, this will also be a challenge. And as clinicians, then we have to be a bit aware about what's the evidence base behind these kind of technologies. What does it claim? What is it does not claim? And be mindful about its potential and the scope, and use it appropriately accordingly. So once, of course, Sri Lanka may also have a regulatory mechanism for digital tools in the coming years, because the necessary legal frameworks have been done. And that probably will allow us also to identify these tools easily. But the problem will be these tools are available worldwide, and anyone can use it anytime, anywhere, without any restrictions. And therefore, we ourselves need to now not only look at evidence base behind the drugs that we prescribe, but you may have to look at the evidence base behind the digital tools that you may be prescribing or your clients may be using. Ethics related to digital therapeutics is similar to ethics related to any other health sector intervention. Autonomy, beneficence, non-maleficence, justice. These are the things that will go into the development as well as implementation and scaling of digital health tools. And this is something that we should now advocate, and we have been advocating. But as clinicians also, you also now need to look at whether these have been fulfilled when these technologies are being developed, because that can tell a story about how these technologies may contribute to the health and well-being of your clients. And of course, as the digital health personnel, for me, also the people who are developing these technologies, they do have their own challenges as well. Regulatory approval sometimes can be nightmarish, even though you know that the technologies work and they are not making claims that may harm the patients. The regulatory approvals are difficult. Clinical validation, the investment necessary to do that in a country like ours, as you can, is very difficult. Of course, in different ways, we also can use the context in order to make certain prototypes develop as well. In addition, the privacy, confidentiality, safety related and compliance with other regulatory requirements, and also product monitoring protocols, all these things are not yet mature enough for digital health production, but they are emerging, and that also is a challenge, not only for those who are developing digital tools, but also for the clinicians who might either prescribe, or the clients who may be using it without much awareness. So this is a little bit about consumer tech and digital therapeutics. I hope you gathered some insights into the two areas. I'll be happy to answer any questions if there's any.
So, thank you very much, Dr. Pandula, now for that mind-blowing presentation. So it's interesting to know how patients have gained control, and patients are able to personalize their health experience through digital health. So there are a few questions now. One such question is there is a rise in the elderly or geriatric population. Now, how to overcome obstacles which might make digital health more accessible to this segment of the population, the elderly population?
Yeah. So Imana, that's a very good question, because we talk about something called digital divide. Basically, that takes into account the different population groups who may not benefit from a certain digital intervention. Like, for example, if you develop, best example is the QR code for fuel. Are there any groups in the community who are left out but without being able to use it? Similarly, in health also, that problem is there. An elderly group is a group where use of digital tools are not really the for them. So as a result, the digital innovators have their own ways. Like for example, sensor-based technologies, which we consider as IoTs, Internet of Things. These technologies may need very minimal intervention in order to trigger alerts or support elderly people in terms of various things. For example, they may do reminders with regard to taking a medicine, or they may, using sensors, they may detect a fall, or sometimes these sensors may be able to guide a person towards a right direction or towards a particular tool. Technologies may be voice activated. It may detect changes in the voice in the environment, or changes in terms of temperature, humidity, or various other parameters. So non-invasive plus limited interaction technologies are there for to facilitate care for the elderly population.
So the next question is also slightly linked to what I asked earlier. Now, will a certain segment of the population expects a personalized experience in therapeutics? So will digital therapeutics, will it be a personalized experience in the near future? Because without a human being, the presence of the human being, so will it be a personalized experience is the question.
Yeah, it will definitely be because Himanta, you may remember, if we all have this experience now. When we go to Google and do a search, or when we go and buy something from eBay or something, next time when you go, I mean, what we see in the screen, the products that are offered to us is totally different to somebody else. So my experience now these days, going to eBay and my interactions with eBay will be totally different to somebody else's interaction in eBay. Similarly, the digital technologies also make use of this data, and that's why I said that these platforms are not really using technology to deliver the service, but they use the technology as intelligence. And that intelligence is what's going to give the personalized service. And the technology, the artificial intelligence, probably be able to give a more personalized service than us, because we don't have the capacity to process all the
Yes.
parameters that define personal, and but the technology can. And yes, I think you are correct. It will be more personalized in the future.
So I think you answered. The next question is about ethical issues in storage and analysis of personalized data. Will it be a serious threat in the near future, where famous persons like health information is leaked, similar to WikiLeaks? So it's about storage and analysis of large big data, I suppose. What is your opinion about that?
It's always a threat, and it has been for the so many years, and even not only in our country, but even high, tech societies like in the US or any other European country, data leaks do take place, and more so in certain hospital systems in the US. Huge amounts of data has been leaked, and there have been a lot of privacy related concerns as well.
Yes.
However, in the future, the trend is towards users or the consumers owning their own data. That
Yes.
means that although at the moment we are more conversant and we are making use of the electronic health records, and the health record is in the cusp of the health professional, and in the future it's more likely to be that health record will be a personal health record under the control of the users themselves. And nowadays there are various technologies like blockchain technologies that can be used to secure these data, unless the person gives the go-ahead to share with the healthcare providers. Even the healthcare providers may not have access to this data. So whatever the data that comes in the form of intelligence may not really be personally identifiable. So these are the kind of safeguards that needs to be implemented even in a country like ours, when digital technologies take over the health sector, and at the moment it's happening. And I think Ministry of Health has also taken steps towards that end. And recently, you may know that data protection regulation was implemented in Sri Lanka also, and that also has given some backing to this aspect as well.
So the next question might sound a bit primitive now. Will there now artificial intelligence taking over patient care, the therapeutics, especially in certain fields like radiology and lab-based specialties, will there be a threat to job security?
Himantha, don't worry about it anytime soon. I don't think you need to worry about it. But
yes.
I mean, you're right. I mean, there may be a fear among health professionals that whether certain tasks that they are doing, taking it over with the softwares, whether that will make them obsolete, and that's a very probably acceptable thinking from the professionals. But what we need to understand is that everything evolves and the technology evolves. We probably, the certain things that we did about 10-20 years ago, we may no longer be doing because it's already done by a tool or a technology. The artificial intelligence or not, it's a different thing. But that's why this to an extent the health regulation is also important, because there are certain decisions that we make as clinicians that probably will not be able to handle at the moment, at least through artificial intelligence. And so it's not the answer to everything. But certain tasks, certainly it can assist the clinicians in making a better decision and to avoid any errors or avoid any potential harm to the patient. So I think as professionals, if there is something good coming out through technology, and the profession then needs to look at ways of using that technology and improving the care, while then our role may in that sense may be a little bit different to what we are doing at the moment. So that's how I basically see it, and I'm sure that we will always adapt.
Yes. So the final question is a very simple one now. When will digital health be an inexpensive thing now and accessible to all? I mean, so certain things like devices, will it take a long time for digital health to be accessible and inexpensive? So
I think accessibility very rapidly, it's becoming more accessible, and probably even for us, if we are not experiencing this recession, I suppose things are much more accessible. The tech before 2-3 years ago, it was actually accessible more. And in the foreign countries, they have done studies, because there are certain consumers have certain spending limitations with regard to health conditions. And so generally what they feel is that a person may spend about less than $20 for various software subscriptions if it helps them take decisions with regard to their conditions, maybe skin conditions or mental health related conditions. So they have consumers have a range of spending with regard to subscriptions. The technologies, some of them are still expensive. For example, VR devices, EEG bands, all these are expensive from our perspective. But why I highlighted the Sri Lankan innovations is that the innovations happening here are very frugal. Like if it is $500 in the US to produce an EEG based mind controlling tool, it may be less than $100 in our context. So that frugality is there when it comes from our own contexts.
Thank you, Pandu. Now, thank you very much, Pandu, for that good presentation. It's always nice to have feature a batchmate of ours. So, before we wrap up the proceedings today, I would like to remind our dear viewers that the CCP Book Club will be held on Saturday, the 30th of July from 7 p.m. onwards, and it will be conducted by Professor P.L. Aryanatha, who will speak on the book, The Habits of Highly Effective People. And finally, I would like to thank again Dr. Pandula Siribandana, Professor Arosha Disanaga, the president of CCP, Dr. Dinesha, Dr. Sudarshan, our secretaries, and the AV team of CCP, and of course the attendees. Wish you all a pleasant evening. Good night.